So the next common question people ask is, how do I detect my cancer early? The best way to detect cancer early is to be aware. You must understand what is wrong with your body, and if something is wrong with your body, go and get it checked up as fast as possible. So basically, national and international guidelines say that 4 types of cancer are cancers which, if detected early, lead to cure. Basically, these 4 cancers are breast cancer, cervical cancer, your lung cancer, and your colon cancer. And for these 4 cancers, they have advised active screenings. Now, to detect cancer early, the first thing is, if you've noticed any abnormal lump in your body, for example, in the breast, anywhere on your skin, or sometimes in your neck, or sometimes in the mouth, then please go and show it to some doctor. Most lumps are not cancerous, but why take that risk? The second thing you should do is get your mammographies done properly. All women above the age of 40 should go and undergo a mammography every year until the age of 65. This has been found to be life-saving against breast cancer. Getting pap smears done. All women above the age of 18 who are sexually active should go and get pap smears done until the age of 65. This should be done every 3 years if you are doing the non-DNA type of pap smear, or every 5 years if you are doing DNA analysis for HPV. Also, you should get regular oral screening, and that especially if you are a person who is consuming tobacco products or a smoker. Meeting your dentist every year, getting your oral hygiene checked, as well as self-oral examination are very simple things that one can do. Oh yes, and remembering breast cancer again, there is something known as breast self-examination. Do read up about it and get it done by yourself if you are a girl above the age of 18. Another cancer which needs to get detected early is your colon cancer. So guidelines say that all people above the age of 50 should undergo a colonoscopy every 5 to 10 years. There is something known as a virtual colonoscopy, which is basically a virtual examination of your colon by means of a highly sensitive CT scan. Something as simple as that done every 5 years can protect you against colon cancer. So it is just education, being aware of something wrong in your body, and just doing these few simple tests can save someone's life against cancer. So what are the most common types of cancers in India? Well, in India and the world, the most common types of cancers are quite similar, but there are slight differences. In India, the number 1 cancer is oral cancer due to tobacco and gutka consumption. Number 2 cancer goes to breast cancer, more common amongst women. The number 3 cancer is your cervical cancer. This is more common in rural women. The number 4 cancer is lung cancer. This is because of the smoking and BD and all these habits. And the 5th cancer, or the 5th spot, is going to stomach cancer. Prostate cancer and colon cancer are also increasing in India, while in the world the patterns are slightly different. Number 1 cancer in the world is lung cancer, because of the smoking habits being rampant throughout the world. Number 2 becomes breast cancer. Number 3, uterine cancer, or cancer of the uterus. Number 4 is your colon cancer. And number 5 spot goes to stomach cancer. So there are slight differences in these, but more or less Indian habits being different lead to more common cancers of mouth, as well as poor hygiene is more commonly associated with cervical cancer. Totally, every year 20 million people are diagnosed with cancer, and India provides a substantial 1.5 million cases contribution to these. That is, 1.5 million people are diagnosed with cancer in India every year, and that actually is just the tip of the iceberg, because many people in India, due to lack of facilities or knowledge, end up dying of cancer without ever being diagnosed. In the world, the cure rates of cancer are much higher. Approximately almost 60 to 70% of people abroad are usually cured or undergo remission, while in India this falls down to almost just 30%. This is because people come in later stages, or they do not have the facilities or the knowledge, or maybe even the finances for treatment, and because of that, results in India are not up to global standards. So that begs the question, why are people more and more getting diagnosed with cancer today? Well, it has just got to do with a multitude of factors. Number one is people are not getting adequate sleep. Studies have shown that people who sleep less than 6 hours a day are more prone to cancers than people who don't. Number two is your diet. Your diet has gone away from your regular healthy diet to junk foods, processed foods. Number three is your habits. Alcohol, smoking, all these habits are directly associated with cancer. Number four is stress levels. Increased stress levels are associated with increased risks of cancer. Number five is the increased prevalence of various infections such as hepatitis B and HPV, which cause cancer. And number six is increased exposure externally to pollution, air pollution, water pollution, and other forms of chemical exposures, which increase people to cancer. However, the two biggest dangers is lack of awareness and late awareness. People who get diagnosed late, and because of that, the outcomes are not as good as one would expect. So finally, we come to the end question. How can you, watching this video, prevent yourself from getting cancer? Well, the answer is very, very simple. You have to just reverse all the wrong things you're doing in your life. If you are a person who smokes tobacco or consumes alcohol, stop it immediately. Take a review of your daily diet plan. Are you consuming excessive proteins, excessive processed foods, excessive maybe chemicals, pesticides? See the kind of food you are consuming. Get back to more organic, more simpler substances. Don't go for highly processed compounds. Go for increased fiber intake in your diet. So such things, small changes will help you get a better life. Ensure that you get adequate sleep. Sleep is very important. A proper study has shown if you sleep more than 6 to 8 hours a day, your chances of getting cancer reduces substantially. See about the stress levels in your life. Try out various stress busting things like take a holiday maybe once every 3 months. Do some stress busting activities like yoga or just simple meditation, getting up early and going for a walk. Small things that reduce the stress levels in your life. See the environment you are in. If there is excessive air pollution, if there is excessive water pollution, especially in areas where there's a lot of construction activity, try and review if you can change some of that. Maintain your body weight, maintain your ideal body status. Don't see if you're someone suffering from obesity or even underweight for that matter. Get more towards your active regular weight. And obviously keep reading up about cancer. Become aware of it. Don't be that ostrich with your head under the ground. Stay aware. Knowledge is power. If you know something, you might understand, oh, I have this as well, and that is how you get detected early. So don't run away from these topics such as cancer. Learn about them. It is not something to be scared about, but something that you should be aware about, such that if it does happen to you, you are the one to mitigate it quickly. One other aspect of preventing yourself from cancer is going and getting a regular checkup. Go and meet your doctor every year. Get your mouth checked up, get your breast examined, get your maybe rectal examination, get your prostate examined. These are all simple things your doctor will do based on your age and sex. Along with that, there are certain vaccines which are known to prevent cancer. The hepatitis B vaccine, which most people now take, prevents liver cancer. The HPV vaccine, which now people take, prevents basically cervical cancer as well as in mouth cancer. So get yourself vaccinated as well. So finally, cancer is not a death sentence. It is something that can be fought and overcome. Just build up better awareness, better knowledge, and together we can win against this disease. We fight cancer not with fear but with facts. Hi, I'm Dr. Prasad Kasbekar. Please do share this video and I'll see you in the next video. Stay informed, stay healthy.